President of the ARC of Virginia. And we want to welcome you to our virtual convention, our first. We're getting better and better on every session. We are so excited and happy to have all of you join us for a very important discussion regarding the Virginia budget and Medicaid services. We are honored this evening to have Governor Northam to speak with us by phone. We want to thank you, Governor, for your commitment to save DD waiver slots and protect the increase in rates for personal care, respite, and companion services in this year's budget. If we could applaud, which I can, we all would be, and we just really want to thank you for being here. So thank you, Governor.
Thank you, Kim.
Go right ahead.
Good evening. Yes, ma'am. Thank you, Kim. Thanks so much, and good evening to all of you, and just so grateful to be with you all this evening. And I want to pay special recognition to our legislators who I know you're going to be with in just a minute, but Senator Barker, Senator Hanger, and Delegate Sickles, they're tremendous leaders, and I know that they are advocates for your cause and certainly individuals with disabilities. So to them, I say thank you on behalf of Virginia. I'm sorry we can't be together in person. We're kind of getting used to, I guess, these Zoom calls and the technology, and I only hope that you and your families are safe and healthy. I have thoroughly enjoyed working with ARC of Virginia over the years, both as a policymaker and also as a neurologist. And I know firsthand that the work that ARC of Virginia does literally changes lives. And so I'm grateful for everything that you do, and we certainly want to support your work and mission in every way possible. All Virginians, including those with disabilities, have a right to enjoy the benefits of choice in society and the freedoms that we have of everyday life. Disability rights are civil rights, and that includes the right to be employed in a real job, the right to live in a community, and the right to appropriate education services, the right to participate in faith communities, the freedom in the way we spend our days. So as you all are all aware, the COVID pandemic has changed our budget plans this year. The new spending we had planned was unallotted while we see how the pandemic's effects on our economy and our revenue play out. And we certainly have a better idea now than we did a couple months ago. Just yesterday, I met with economists to talk about our revenue picture. And in a couple weeks, on August the 18th, my legislative friends will be back in Richmond, and we'll have a special session to talk about our budget issues and how we move forward as a Commonwealth. I know that developmental disability waivers and provider rates are a critical issue to the ARC, and I'm sure you will make note of other things that are your priorities as well. So I really appreciate all the work that you do to advocate for the dignity and the rights of Virginians with disabilities. I hope you all have a great convention. Again, I'm sorry we can't be in person, but I hope to see all of you soon in person. So thanks to all of you, and I look forward to being with you as soon as we can get this pandemic behind us and move on to as near normal as life as we can. So thank you, and stay healthy.
Thank you, Governor Northam. We know you're a very busy man and you have a lot on your plate, and we really want to thank you for being here this evening and speaking with us.
Thanks so much.
Next, I'd like to introduce the panel that we put together this evening for your questions and information. First, I'd like to introduce Delegate Sickles. He represents the 43rd District, and there he is waving at us. Senator Hanger, who represents the 24th District and is unable to wave at us because of bandwidth issues, but we're so glad that he's here. And then Senator Barker, who represents the 39th District. And I'd just like you to know that all the legislators on this panel have been champions for our cause, and we're so grateful that y'all are here with us this evening. Next, I'd like to introduce Commissioner Allison Land with the Department of Behavioral Health and Developmental Services. And she is on the phone, so we're not able to see her. Kim Kinsey, who is Director of Medical Assistance Services. We're glad to have her. Jessie Monroe, who is a disability rights advocate and serves on the ARC of Virginia board and the newly formed A Life Like Yours Self-Advocacy Alliance. Welcome, Jessie. Kelly Brooks, who lives in Henrico County, is a mom of 3, is an advocate for inclusive education and improved supports for families caring for those with disabilities. Kelly's oldest child has cerebral palsy and requires nursing care, and Kelly's here to help us share her story. And last but definitely not least is Tanya Milling, the Executive Director of the ARC of Virginia. So first I'm going to call on Kelly. We want Kelly to share her story on how rates impact her and her family's life. Kelly?
Hi. Thank you guys so much for having me this evening. As she mentioned, I do have a daughter with cerebral palsy. She's the oldest of my 3 children. She is pretty significantly impacted. She is in a wheelchair. She needs assistance with all activities of daily living. She's nonverbal. She has a feeding tube, epilepsy, lots of fun stuff. And she is also awesome. And so I want to talk a little bit about private duty nursing for her. We could not function without it. I wouldn't be able to work if we didn't have help with her. It allows me to keep my job, albeit part-time. It allows my husband to work full-time. If I had to quit working, I don't know what we would do. We're not one of those one-income families. So nursing also keeps her safe at school, and it keeps her at home. As opposed to in an institution where she would be vulnerable in a myriad of ways. I don't have to worry about her if she has a nurse with her. And it just takes a huge burden off of us. The problem, of course, as you well know, is that the provider rates are woefully low. The nurses that we have had make $15 to $17 an hour, which is basically what a Target cashier makes. Both admirable positions, but these are licensed healthcare professionals, and they should be recognized as such. They're also taking care of our most vulnerable citizens, and they should be paid for it. When a nurse leaves, it is unbelievably difficult to find another one. Months can go by before that position is staffed again because people just don't want to work for these rates. They're some of the lowest rates in the country, as I'm sure you're well aware. I know families who have gone a year or more without a nurse, and parents have ended up having to quit their job because their child needs care and there's no one to fill that position. And that is really, really hard, as you can imagine. It's a lot of stress on a family, financially, emotionally, psychologically, physically. And my daughter actually qualifies for 56 hours of nursing a week, but we've only ever been able to staff about 40 of those hours because there just isn't the staff there to fill the position. So if I had those extra hours filled, I could work more. I could actually maybe get a break every once in a while. It would be nice to have all of those hours filled, but in her 10 years, we've never been able to fill all of those hours. So what is the solution? What is the ask? It's to have the rates increased. Families are struggling, as are the nurses who are caring for these individuals. Having nursing allows these people to stay home with their families. It improves their quality of life. It improves the entire system, really. It improves our quality of life as a family. It improves our financial situation. It improves the financial situation of the nurse if they're able to do the work that they love doing, if they get paid a fair wage for it. So really, it means better care, fewer hospitalizations, less overhead from an institution, and an improved quality of life for everyone involved. So I hope that you'll consider that.
Kelly, thank you very much for sharing that. I know it's really hard for families to come on and share their personal stories, and what you do for us, this is what makes this possible. So we appreciate you having the courage to do that and sharing that.
Well, thank you for allowing me a platform for it.
Jesse, we're going to go to you, and if you could just explain how rates impact your life and the struggles that you've had to go through.
Sure. So my name is Jesse Monroe, and I get services through Hope House. They allow me to live independently in my apartment with the right supports. I since I use these services, I use the services for all my daily functions, and also to live in the community and go places and do things like everyone else does. Um, and I know that the waiver rates have really affected my life, especially before I came to Hope House, when I lived on my own independently or with my family. I didn't get enough care, or they were unreliable and didn't even show up. And I know that was partially because the rates were so low that, yeah, that's why they had unreliable care. And in fact, some of my family members actually lost jobs over it. And since I've moved to Hope House, my situation has been a lot better. I can do a lot of things that I want to do and all things I need to do. However, it's not been perfect either. There's a lot of turnover at the Hope House I've been, and that has, it's hard to have a good routine or do things that I want to do when I'm constantly having to tell new people how to do things and how things work, and then you don't know from day to day who might come in. So that's a big problem, and I think that, and also the people helping Hope House are very special. They do a great job. They do a lot of good work, and they should get paid a lot more than what they do. And I think it'll make better services, and it's also just a moral issue. It's just the right thing to do. And I think that if we don't increase these rates, this problem is going to persist and maybe get even worse. And me and other people will not get the services that we need and want. So that's why it's so important.
Thank you, Jesse. As you can hear, Jesse and Kelly represent Virginia families all over Virginia that are suffering for the same things for various reasons: nursing rates, underpayment, just for direct care. And we want to thank you because we do appreciate your commitment to the allocated DD waiver slots that are currently in the budget. But our question is the reallocation of rate increases for waiver services, which includes nursing, DD waiver services, a priority that you will work on during August special session to protect these rates for individuals like Kelly and Jesse? And I'll start with you, Delegate Sickles, I'm sorry. Wait a minute, you're muted. Hold on, I'll get you. No, I can't. There you go.
Am I on now?
You are.
Good evening, everybody. Thanks for inviting me to your annual meeting. It's good to hear your introduction, Kim, and hearing from Kelly and Jesse. It's meaningful to hear this. I do hear it through the year, and the rate situation is abysmal in Virginia. I recognize it. The subcommittee that I'm chair of in appropriations recognizes it. It was on a bipartisan basis. It was our number one concern this year. I wish we could have done more than we did, but then what we did do was so-called unallotted. I'd never heard that word, unallotted, until this year. And the issue we have now is what we can afford. As the governor said, we have a better indication of our situation, but even with what is called the standard projection of revenue of the standard forecast, which is a little pessimistic, we are going to have to cut, according to the administration, $1 million in 21 and 22. And in just 21, in the year 21, we unallotted $850 million. So my math is not great, but we're going to have to find another $400 $500 million to cut just what added. So I think most everyone I talked to, if not everybody, added to the budget this year is more important than some of the things that we have routinely funded over the years. Making these decisions, though, is terribly difficult because, you know, the public supports most everything we do that costs significant money, you know, higher education, K through 12 education, some conservation and parks and preservation, law enforcement and criminal justice. These things are supported by the public, and we're going to have to cut into some areas in order to find money to keep the promise that we made last winter to provide better rates for Medicaid providers. So all I hope is the governor gives us a good proposal. I think that if you can help us out by suggesting ideas of ways you can spend one-time money to help out for things like hazard pay, other items that are COVID related that would overall help secure other funding for rate improvements. It would help because we're 13 days out from the special session starting, and we have not seen a proposal from the governor yet. And so I'm trying to collect my own ideas from people like ARC of Virginia on how we can make the right adjustments to keep this highest priority. It really is the highest priority. We have a lot of priorities, and we campaign, for Virginia to be the best state for business, that we have the best educational system. We have one of the best higher education systems in the country. All those things are popular, but we need to get money into this area. So, and we need to figure out how to do it. The settlement agreement, when I hear talk to people that pay attention to this subject area, I haven't found anybody yet who thinks we can exit the settlement agreement in 21 like we're supposed to. And the lack of funding. So we've had some progress with the training center issue. All of us on this phone, we're glad to have taken literally thousands of people that had institutional care and now community, but we have so much more to go. And so we're looking for ideas. I want to help. And I'm looking forward to hearing what my two friends in the Senate think on this subject, because we really need to put our heads together and do something meaningful in this special session. Thank you.
Thank you, Delegate Sickles. Senator Barker?
Sure, I'd be happy to jump in here and follow on to what Delegate Sickles talked about there. I've been working at these issues for many, many years, worked with the Regional Health Planning Agency in Northern Virginia for over 30 years, and then started dealing substantially with issues related to the ARC of Virginia in 2009, when I had a bill in that basically said we would try to eliminate the waiting list for the waivers over a 10-year period. Partly because so many new people kept coming onto the waiting list, we did not make it within that period, but we have made a lot of progress, and certainly I think are handling things in a positive way these days, both in terms of what Delegate Sickles talked about as it related to reducing substantially the population, the number of people that are in the training centers, or the training center that the last ones that are left now, but also to continually add a number of new slots every year, as well as do what we can to address the issues that are in the settlement agreement. So I think there's been a lot of progress made, but there's still substantial ways to go, and we need to continue to, to pursue those challenges as best we can. I've every year put in budget amendments to increase the number of slots that the governor or whoever had proposed funding and have been fairly successful in getting additional funding to reduce the number, to add to the number of people who are receiving the waiver services. In addition, was very pleased last year when the ARC and others came to us and said, rather than put a large amount of money into reducing the number of slots, we need to deal with the rates. We need to deal with the rates in aggregate, and we need to deal with the rates both for the individuals who are providing the care to people who have disabilities, as well as to the agencies that are working with a lot of those people. But we also need to do things to deal with some of the other issues, such as the limitation fees that we had put on as it related to the overtime, because that has been a huge issue. And as Kelly talked about earlier, it's one thing to get somebody that's there for 40 hours. It's another if you're eligible for 56 hours, to get one person for 40 hours and get somebody else for the other 16. At least if you have someone who's there the other 40 hours, there may be opportunities for them to then be able to increase their own pay by agreeing to continue to provide services beyond the 40 hours for which they would qualify not only their regular pay, but also the benefits of it being overtime. And so we were very pleased to be in to move in that direction this year with the budget that we passed on March 12th. Unfortunately, 4 days later, we were heading into shutdown in Virginia, and a significant loss of revenues. Well, a modest loss of revenues. It was nowhere near as bad as a lot of people had anticipated. It was less than 25% of what we had anticipated in terms of the shortfall in revenues. But it did have some impact on things, and it did put us in a position where, as I'm sure you're well aware by now, a lot of the things that we funded, and I think we put together a fantastic budget this year, a lot of the things that we funded in that budget, we had to unallot those when we came into our veto session in April. We will be dealing with some of that as we go back down on August 18th. And I think that there are challenges for both fiscal 21 and fiscal 22 to deal with that. I think the fiscal 21 issues are more difficult, partly because we're already into fiscal 21. And it's, we have to deal with a lot of uncertainty at this particular time. If Congress should somehow get its act together and in the next week and a half come up with a funding plan that allows monies to be provided to state and local governments without having all the strings that the CARES funding had placed on it, and that we can, including being able to deal with some of the revenue shortfalls, we may be in a much better position when we come down on the 18th to be able to address some of these issues. And part of what gives me some hope on that front is that we are actually in a much better shape than most states across the country, and particularly most states of sizable population. There are only 2 states in the entire country that are near us or a little greater than us in terms of population that have an unemployment rate lower than what we do right now. And one of those is Georgia, which is now sort of becoming one of the hot spots. It's right behind Florida and Texas and Arizona and California in terms of the number of new cases popping up. So what's happened is a couple of the states have gotten a little better economic or a little lower unemployment rate, but they've had really, really negative impacts upon their disease rates, the virus rates, and the death rates from those. So I think we've done a good job of managing our overall in terms of managing the situation with the virus, and still done a pretty good job with getting the economy moving forward. We're already over 2.5 percentage points lower in unemployment rate than the national average. And we're doing everything I think we can to be able to get us to the point where we can fund as many of the services and programs that we had anticipated when we put that budget together back in early March. So I think there's going to be some challenges on that, but don't lose hope if you don't get everything you would like and when we come down on August 18th. And we'll probably be down here for about a week and a half anyway, because we will be back in January, and we may have a much clearer picture on some of those things then. And there may be opportunities in the interim to deal with things, particularly if we haven't gotten resolution of what the federal funding may turn out to be. And just to provide a little more optimistic tint to things. I think in fiscal 22, we have a very good chance of being able to, although right now the projections are showing that revenue projections are down. I think there are some indications that things may turn out to be much more positive than what's going to be projected when we come down here on the 18th. And I think that will put us in a position to, if not be able to restore a lot of the funding that we had initially put in the budget in fiscal 22, if we can't get all of it in there, cram all of it in there, I think we have a good opportunity to be able to say, if we meet these certain targets in terms of our revenue and in terms of our expenditure levels, that we will be able to go forward with a lot of those types of things. So I think there's a good opportunity to get restoration of things in 2022 that we may not get completely done in 21. I can guarantee you that we are all committed to getting it done to address these services. A lot of these have been issues that have been confronting us for years, and we've not had the resources to be able to do everything. But I think we have the commitment and are likely to have the resources as we move into at least into 2022 and beyond to be able to be much more aggressive into these. We did pass an increase in the minimum wage this year that will go into effect May of next year. That will provide a lot of incentive to come forward on this because that will help deal with a lot of the issues for people who either are at that minimum wage level, which will go from $7.35 up to $9.50 an hour, or to be able to, or just a little bit above that, but will then sort of move up commensurately with what's happening to the people who have been paid a little less, been paid the minimum wage previously. So I think there are a lot of things that do put us heading in the right direction. And I look forward to continue to work on all these issues, to eliminate that priority one waiting list, to be able to have the number of providers providing good, high quality care to everybody in the Commonwealth, and to make sure that the care is not limited to 40 hours a week.
Thank you, Senator Barker. I just want to clarify on the overtime issue. You're saying that you would increase the budget so that we could meet the overtime, the new
Yes.
minimum rate. Okay.
Well, we would increase the budget. We'll have to increase the budget as it relates to the minimum wage. That will clearly drive up the expectation in terms of the rates that would be paid to people who are not being paid much more than minimum wage right now. But also what we have is right now, a few years ago when there was a ruling that we had to start paying a higher rate, the federally mandated rate for people who were working more than 40 hours a week. We limited the services that they could provide to that 40 hours. What it did was it resulted in a lot of people who were getting more than 40 hours a week from an individual person who was providing all the care to the individual person within the family who had the needs, that they were limited to 40 hours. They did two things. One is it was often then very difficult if you qualified for 48 hours to find somebody who's only going to be working 8 hours a week with your family member. Secondly, what it did was it actually put some of those people who were providing more services than 40 hours a week in a position where their income came down substantially. And some of them, not few of them, but a fair number of them end up leaving this profession to go somewhere else to make more money, because suddenly their income was substantially reduced when they weren't able to provide, say, 56 hours a week rather than 40 hours.
Great. Thank you very much. Senator Hanger,
Yes.
we'd love to hear from you.
Well, thank you all for inviting me to be a part of this conversation this evening. I expect I'll pick up more information than I will be giving out, but sometimes that's the way it is. I do enjoy your convention. Actually, I enjoy your convention more. Like I was at your one in Norfolk, I guess the last one I was at, and y'all are a fun bunch of people and you eat well. And I'm not able to participate in that here at my home tonight. So at any rate, it's good to share information always with Delegate Sickles and Senator Barker. They're my buddies, and we've spent a lot of time working on HHR issues. Thank you all. It looks like you got a large group online here tonight, about 130, but 63 of them are chatting. I hope they're chatting about what we're talking about rather than just chatting. we're supposed to be going into special session for the budget, and that still should be our priority. As you're all aware, some other things have come up, and I hope we don't lose sight of the fact that our primary mission will be to focus on the budget and necessary adjustments as we look at areas where we need to establish priorities to unlock some funding. You know, you highlighted the need for the adjustment in provider rates, and you know, we thought we had taken care of that in a modest way, but it was unallotted. It would cost us about $22 million a year to restore what we originally placed in the budget. So I would say that's a priority. I'm hearing from a lot of people who, you know, who want certain things restored and certain things increased, and they ask for a commitment. You know, will you assure me that you'll fight for this or that? The problem is the governor alluded to at the beginning, is that we have finite resources, not like the federal government. They're throwing a lot of money around that they don't really have, and we don't have that luxury. So we're obviously, I am a strong supporter of getting those provider rate increases in place. I think that should be a priority, and I will work to see that that happens. Having said that, I think Delegate Sickles, when he was sharing numbers there, it's not very rosy as we assembled back in August. It's better than was originally anticipated. We actually had in our 2018 through fiscal year 2020 budget a pretty good run with HHR. We were able to do some things that we hadn't been able to do. Some of that came about because we were able to expand Medicaid, and that relieved some of the pressure on spending so that we had additional dollars that we could put in other areas. So we continued, and all three of us were a part of the process. I had the opportunity to be co-chair of the joint work group that oversaw the closure of our training centers. I was really pleased with that and the support that ARC gave to that all around the state as we were able to do that, because at times it seemed like we wouldn't be able to accomplish that. A part of that, not just to satisfy the settlement agreement and get out from under the settlement agreement, was to provide better services for our citizens that required those services, but also in a more cost-effective manner. The whole concept is to reduce spending on institutions and then plow that money back into community-based services and other areas where we can help our citizens and their families that are in need of those services. We haven't finished the job there, so we still need to continue working on that. Same goes for the waiting list. Senator Barker did introduce a kind of a challenge that we're going to eliminate that waiting list in 10 years. I think he did that 10 years ago, but we're not quite there yet, George. So we'll have to continue working on that. It does seem that we've made progress, and yet what we're doing doesn't seem to be getting us there. So I guess we're all going to have to kind of put our heads to the task and see if there are different ways that we can go about meeting that challenge. I really believe, you know, when there's sometimes a silver lining in the circumstances that we're confronted with, and I believe in a number of areas in state government and in our life in general, we're going to be examining, you know, what we do on a daily basis and maybe come up with some ways to do things better, more cost effective from the state government, and reestablishing priorities to provide services to those in need of services. We are, of course, as we did finish out the fiscal year 2020 in a little better shape than we had thought we might. We were fortunate that we were on an uptick, and we had a number of a significant amount of money in our rainy day fund and our reserve. But as we look to the out years now, we really are going to have to be cautious. I think it was Senator Barker that just mentioned that we will know better in January. So we'll make some adjustments when we go back in August, hopefully, and we'll focus on those rather than having a whole mini session with all kinds of issues. Hopefully we'll focus on the task at hand, but keeping in mind that come January, you know, we'll be back at it again, and with a little more knowledge about where we're at, and so we can continue from there.
Thank you, Senator Hanger. I did have a clarification. are we saying that that the rate reallocation would cost about 22 million? Someone had just asked for clarification.
Tanya, the numbers that I have indicate that the refresh on the provider rates would be $22 million a year that we would have to unallot
Yes, sir. Per year.
per year.
Yes, sir. That doesn't include the nursing rates. I will say that the nursing rates, and Karen, thank you, you're shaking your head for me to confirm that those are separate. And I believe they're 12 million over 2 years, so 6 million a year for the nursing rates, which, as you've heard from Kelly, and I know you've heard from your constituents as well, what a dire need that is. And I would just say all of your comments were very helpful, and I think that it is reassuring to us to know, and we already knew this was a priority for you, but you know, to hear that we're all focusing on the fact that these direct support professionals, people working to provide services to people with disabilities right now, that is completely in line with what's happening with COVID. Without the rate increases, these are the exact people that are on the front line keeping people safe. That really, Delegate Sickles, you mentioned hazard pay. They deserve hazard pay as they are the ones keeping people safe and healthy, sometimes at the detriment to their own lives, as we know many people are doing. So I think that we know our providers needed these rates. More important, our families need these rates, and we knew that before COVID. So it's even a greater need at this point. And any of the people on the priority 1 waiting list that were in that priority 1 because of their life circumstance before COVID, it's simply escalated at this point. How could it not? The only other thing I'd like to mention on the budget, Delegate Sickles, you talked about, and I know that you like data, all of you like data as much as I like data. I would be interested to know, and perhaps you're able to get, or Karen and Allison, you may be able to answer this as well, but we would imagine that with many of the programs closing down early in the shutdown, that there was a reduction in the utilization of services. So significantly in our day support programs, any of those day programs, even in some supported employment, unfortunately. So with that reduction in utilization, my question would be, there would have been a savings at that point. Do we have the evidence that can show us how those funds are remaining in the DD system and can be utilized to support DD services?
I'm happy to answer that. As a matter of fact, I'm so glad you brought up day support. We were able to track, because we have advanced data system analytics now in our program. So happy to be able to say that. I'll reflect on that a little bit more later, but to be able to track and see in fee-for-service that there was a downturn in utilization in that particular service, which is one of the reasons why we were able to, in the administration, set up retainer payments for those providers. We literally took the funds that were on a decrease for this past fiscal year that ended June 30th and converted those into retainer payments, and we actually paid the providers to support them from the period of the public health emergency through the end of the fiscal year. And we utilized those dollars that were actually not being used for that purpose to the tune of $18 million, specifically for day support so far. And so we were, and I think that's a perfect example of using active real-time data to see what the system is doing or not doing. And people were simply not utilizing those services. So we were actually able to make those payments to providers to help support them during this period of time.
Okay, that's very helpful. Very helpful to know. Thank you.
You're welcome.
Go ahead, Kelman.
Anya, there's some worry.
What did you say? I'm sorry, sir.
Delegate Sickles, you're jamming up a little bit.
I think I started talking when someone else started talking, but I was going to follow up with Director Kimsey on the retainer payments. Thank her for doing that, to getting that money out. But I know a lot of providers now are worried about the next round of retainer payments. It's very scary that they might not have those more. So I'm glad you have time approach. Can you give us a date when you'll be able to tell us about the next round? Or if you can, how much you think you can extend this?
Right. Well, one of the retainer payments are very helpful, but only for a short period of time for certain services. So federal restrictions only allow us to cover retainer payments for a period of 90 days during a set period of time. So for example, for day support services, we've utilized that window that's federally allowed for the next year. And so we'll have to look at other creative avenues, and we have, in some examples, allowing flexibility for day support providers to go into an individual's home, residential setting, or their own homes to render day support services. So to help offset for that, and I also have Ann Bevan, who's my secret person beside me to help me with some answers. But what we're trying to do is, now that we know that those federal retainer payment flexibility we have exhausted for that window, what else can we do to better support individuals and their families and the providers during the next, as we all know, this wave, was not acute, short period of time. This is a longer window for us. And so we're very eager to continue working with you all to make sure that we support you the best way that we can and your loved ones. And that will also not just be for the creative things we're thinking of now, but also for other services. We will continue to closely monitor utilization and be able to work with the administration, also with our esteemed legislative members here who have always been very, very supportive of all of these changes for any future needs that we may have going forward, and working with you all either in special session or during the regular session.
All right, thank you very much for that, Karen. And so I just want to stress, I guess, as we move on to our next category, is when we talk about reallocation, the Arc of Virginia supports reallocation, not so much refresh. So I don't know if we have the figures on reallocation, but nursing rates are probably the top of everything after, I guess, a refresh. And Tanya, correct me if I'm wrong, but so when you see people like Karen and you see people like Jesse, when we went into this whole new waiver system, these rates were not even what that company, I can't, that came up with the rates. It was lower than what they had even recommended. And when you hear somebody like Karen talk about 10 years, I just want to stress, as a parent and a volunteer and the president of the Arc of Virginia, that our families are our priority. And when our children can't get services for 10 years, or Jesse can't get nursing services, we need that to be a priority. And we thank you all for how much you've helped us and things like that. But when you go in there, to fight for these rates, I hope you keep nursing in the back of your mind that this is something that we've been addressing, for quite some time now, along with DSP rates and all the other rates. But, nursing is probably at the top of the list right now because our families are seriously suffering. And, we don't want to see children institutionalized and people have to go back to nursing homes because they can't get, nursing care. So having said that, we are now going to move into our virtual services. Tanya, and could you help us understand how virtual services affect those with developmental disabilities?
Yeah, and I think it was great, Karen. I think you were really kind of alluding to some of those flexibilities. We had a session yesterday with the Department of Justice where they hosted, the attorneys there hosted families and people with disabilities to come in and talk about their experiences, not just during COVID, but overall. But as you can imagine, the experience during COVID continued to come up. And one of the themes that we heard over and over was the positive impact that virtual supports have had in people's lives. And you can imagine, I'm sure you're hearing the same things, the worries, and I think that I've heard even your team, your secret team there that you said is there with you, talking about how that's being looked at and how virtual supports can possibly go into the future. I will say that it's heartening to see over and over, we're hearing people with disabilities say that a silver lining, so to speak, is that they feel more connected now than they ever have been. There's a real accessibility change. We have a young man that comes to mind for me. His name is Ben, and he doesn't use words to speak. And so having to go to a meeting, any of these kinds of meetings, forums, places where we all want people's voices to be heard, in a room of 30 people, if you don't speak with words, he really gets, his voice gets lost, his opinion, his perspective gets lost. But on these Zoom meetings, the playing field is leveled, and he's texting in there and he's chatting, and it really levels out and brings his voice to the forefront with all of our voices. And I think that is an important accessibility factor. And Jesse, I would ask you maybe to share any things that you've been aware of from the Alliance members, your self-advocacy group, that sort of thing.
Yes, I can attest that you're right. The Alliance that I'm in, we've been, because of technology, we've been able to do a lot more and meet more than we probably would ever be able to. We had to do in person and get accomplished a lot more. I think technology's been very vital for me for a long time. I use a voice activated computer. I do a lot of meetings on my computer. I have an apartment I use technology by voice to operate my lights and open my door and things. So I think technology going forward is going to be vital for people with disabilities.
Mm-hmm. I think you're right. Karen or anyone really that wants to speak to virtual supports, please do.
I can start if that'd be helpful. And so I'm just going to skip ahead and tell you I had a slide on this, some of this, but I have to tell you, you are so right. It really is a silver lining for us when COVID happened, that we opened up telehealth and just said, hey, we want you to be able to communicate with the providers you need to, the clinicians, your doctors, whoever you need. Open it up, and not just like the video piece, but just on the phone even, which is unheard of nationally. And even the federal government said, yes, go ahead and do this. And so that was a huge barrier for us initially. And then they opened it up. We were hearing all kinds of promising, positive things, just like you're saying. I've even did it a couple of times, and it was nice, being able to connect that way and stay connected with who you need to, and without having to worry about going out or people even coming into your home, but still being able to get what you need and the supports that you need. And so that's just been we even saw, and for people who use healthcare services, people who utilize Medicaid sometimes tend to have a higher no-show rate for services than other people. And we've actually seen that percentage decrease for people actually being able to gain access to without worrying about transportation or different types of things. And so you have our full assurances that we will work with our legislative partners if we do need permanent changes to seek the continued flexibilities beyond the public health emergencies, that we will partner with them to look into that and see what we can do. Also, as a quick note and reminder for folks, assistive technology is funded under the waivers up to $5,000 per year for individuals, especially the DD waiver. And so please take advantage of that. Utilize those funds to get the technology that you need to be able to continue to engage in this manner.
Well, and I would just like to interject. I'm sorry, Tanya.
I'm sorry, Jesse.
Go ahead, Jesse.
Jesse, can I mention something regarding that? I tried utilizing assistive technology with my DD waiver, and the problem I encountered was there was no providers that were approved under Medicaid in my area. So while I had those sort of on paper, I didn't really have them. So that is an issue that has to be addressed.
We are working on that issue. Thank you for bringing that up, and it has come to my attention that we are working to address that, and hopefully we can get that corrected for you soon.
And another point that was brought up when we were meeting the other day is with the Alliance and other members, is that there's a lot of red tape to get access to that tech money. And a lot of hurdles have to be met by providers. Like you have to go to a therapist. The therapist has to write the order. The therapist has to say, you can have a Chromebook or an iPad. And given COVID and the fact that even people with significant disabilities can benefit from virtual learning and the schools are requiring it, it seems like to me that maybe we could ease up on some of, I don't know how it works, but I'm getting the chat room is going crazy because parents have tried to get tech for their kids for years, and it's just complicated. And given the fact that we're living in a virtual world, we really need to figure out how to make this easier. I mean, because you can buy a Chromebook for, $250, and the part about going to the specialist and all that's going to cost more than the $250. So that's what we need, parents need, and people with disabilities and Alliance members, they need access to their own, and they need to be able to access it quickly, not take 90 days, for approval and to go through all these hurdles. So if you could maybe address that.
Well, and I think that that's a good point, because when you look at our typical definition of assistive technology, and that question has come up for us, it's not as much about assistive technology, or more like what Kim's saying is it's a virtual world now, and people with disabilities often haven't had the access to technology that is technology for everyone, laptops and computers, and so if those things can fall into that $5,000, but and this probably would require partnerships with our General Assembly friends to allow for those purchases, if that could fall under there. And you may not know that now, but it might be something we could look at.
Okay. Well, this is Karen, and so you have our assurance that we'll take a look at if there are any flexibilities that we can look at now, and then also work with our partners in the legislature to see if there are any permanent changes that need to be made, for sure.
I think
we do want people to be able to, we do want you to be able to gain access to these. That's the whole purpose of embedding them. I was a DMAS when we put them in the program. Absolutely, you should be able to have access to them, and we'll see what we can do on that.
Yeah. Well, and perhaps maybe one of the senators or delegate, what are your views or things that you've been hearing from constituents related to this topic, or ideas that you have about how we can be more accessible in this virtual world to people with disabilities?
Well, it certainly has exploded just since last March.
Yeah.
March of this year. So it's been a complete surprise to a lot of people as to how well it would be received, how well it would work, the impact upon people not showing up for visits and those types of things. And what we're hearing now basically is not only are we going to be trying to do everything we can on the public side in dealing with these issues through Medicaid and the various programs that we have, but the private sector is moving aggressively in this area. Mm-hmm. And a lot of the things that they did, they're already looking at how they can maintain as many of those going forward. So it is it's a new world out there. I think the two of the biggest things in this new world have been telehealth and people basically telecommuting, staying at home and still doing their job. So those two things have been totally turned upside down. And in both cases, what they're seeing is that it's much more effective in many instances than what anybody had anticipated. And the downsides have really not been there to the providers or the business communities that are dealing with a lot of the teleworking issues. And if anything, teleworking is even going to be more broader spread, pervasive than even telehealth. So,
yeah, I think you're right.
I think we're, as Senator Barker said, I think we got a window of opportunity here, and maybe have some federal funds that can be targeted to this issue. We're trying to get broadband across the Commonwealth to places that don't have it, and that includes inner cities and rural. Our school children, aren't going to be in the building largely. And so it's more important than ever, but the disability community, I think this is going to be an opportunity to maybe invest more than we ever have. So as I urged you earlier, please give us specific requests in this area for the use of one-time money. This is a great use of one-time money to get the technology, the hardware in, and then hopefully we can have the ongoing support paid for from a waiver in the future. You know, the monthly charges, things like that, be covered.
Senator Hanger?
I think, most of what needed to be said has been said in that area. It is exciting to see some of the transition, but it's not going to happen just automatically. That the technology's there, and we've been working on deployment of broadband for some time now. It's very costly, but in addition to the technology, there's a lot of training that's necessary. We just can't presume that the folks that are providing the services are going to know what to do with it so that it's efficient. But yes, the technology is evolving actually. So I think the cost factor, which is pretty hefty right now when you talk about, deploying it statewide into all the remote areas and inner cities, there are various technologies that are coming online now that are more cost effective. So we'll be able to handle that part of it. And I agree with Mark, Delegate Sickles, that it would be a good use of one-time money to put the hardware in place for in some of these areas, so that it can be just as common as having a TV set there and having two-way communications.
Thank you all very much. Now we're going to move on to our state agencies. And again, I want to thank Allison Land and Karen Kimsey for being here. I don't know what order we're going in, so whoever would like to start first is more than welcome to start.
I'll tell you what, I'll be sharing screens for both myself and Commissioner Land. And so let me start, and then I can, because I have to work with my screen. So if you guys will just bear with me for one quick minute, and
I'll interject to give you a moment to set that up, if I may, just to make sure that everyone on the phone or on the computer knows that keep putting questions in the chat box. There is not a chance in the world we're going to get to all your questions, but we do have a team of folks who have been reading the chat box and are watching for themes and looking for things, so that at the end we will have a few minutes where we're able to cover those themes with either the senators or the delegate or the state agencies best that we can. So just continue to put those in as you can. Okay.
Okay, are you ready for me, Tanya?
Yes, go ahead. Thank you.
All right. So now I'm looking at a screen. You're going to see me with my glasses off. So just don't appreciate. And so one of the things we've also, I'm just going to do a quick update. The team at the ARC gave us some few ideas for me to talk about with you all, and I'm happy to flow through them with you. Some of the agenda things to talk about, really just also, but really enjoying the conversations that we're all having right now, because it's really important for me, and I know for Commissioner Land, that we're here for you, that we help answer the questions that you have. So I'll flow through slides and also make sure we have time to answer any additional questions. So I was asked just a little bit to talk to you all about where we're going with our agency's priorities, and I'm very pleased. It's just such an honor to be here talking with you all, and also to be helping to lead this agency at this very critical time. As you can see here, we have significant priorities, but first and foremost at the top of this pyramid is you and our families who are our members. The focus is twofold for us here at the agency: to demonstrate the value of the Medicaid program, because we help support over 1.6 million individuals, Virginians here, and also to make sure that the services that you make are receive are high quality and of value to you. And so you'll see that here, that the second component right here, our mission is to improve access to coverage and to make sure the care that you receive is of high quality, and always will be for us. And the way that we do that is we make sure that our systems are modern, and we just talked about that a little bit, about making sure we are data driven. You can see that there as well, that we use the data real time coming into us to be able to make those critical decisions that help support you and the providers who support you as well. For example, the retainer payments are a perfect example of that. Also, for us, we want to make sure we're always in compliance in the work that we do, to make sure we're in compliance with federal and state authorities, and also working very closely with our legislative partners as well here on our panel, esteemed partners. We also, because we are about 1/3 of the state budget, it is, we need to make sure that we exude financial accountability and responsibility at all times, and making sure that what we pay for provides, as I mentioned to you, is a value to all of our stakeholders, including our taxpayers, and that we are open and transparent and accountable at all times as a program for you. And also, our workforce here at the agency, Tanya was mentioning this, but we recently shifted 700 individuals to teleworking, and they just kept working. Didn't skip a beat in terms of supporting you all and the program itself, but we also have a heavy focus on making sure we take care of our team so we can best take care of you. Sorry, I'm trying to, there we go, moving my slides here. So as you can see with our enrollment, I mentioned earlier, we have 1.6 million Virginians on. It has continued to grow at an exponential pace, especially with COVID. We now serve 1 in 6 Virginians, and 40% of all births, children who are born here in the Commonwealth are Medicaid babies. And 96% though of all the services that we care for within this program are rendered through what we call managed care systems, of which you're very familiar with. And in the DD system here, for you all, it's acute and primary care systems services in the DD system. And if you receive services through Commonwealth Coordinated Care Plus, then all of your services are supported through you by managed care. But wanted you to see the total number of people. We still have a significant number, large number of children, but all the other individuals here, adults, persons with disabilities, aging individuals, and now the new category, the childless adults, you can see right there, growing quite a bit with Medicaid expansion. And this has been particular importance for us, especially with COVID, because we've added over 115,000 new members to the Medicaid benefit since the public health emergency started. And there's 115,000 individuals who now have health coverage to support them during this very critical time, not only for all the members currently in the program, but for all those new individuals who may have lost a job or in other circumstances as had them eligible for Medicaid now. So we mentioned, we say this over and over, that we've got our members covered. We've got you covered in terms of access to coverage. I mentioned that earlier. Thanks to our members, all of our partners here at the legislature, we expanded Medicaid in January of last year. We have now over 440,000 people in the program, and that does include individuals with developmental disabilities, either through the regular Medicaid program or also in the waiver itself, through this particular benefit. So you'll see here some of the things that we did for flexibilities to take care of people during COVID, making sure that no member loses coverage during this period of time. So we've extended the renewal periods for people. We've suspended co-payments. Service authorizations for many services were lifted to be able to make sure if somebody needed to get access to care because they may be sick due to COVID, then they got that. You don't have to go to the pharmacy as much for many routine prescriptions because we got 90-day supply set up. And also, we talked about this already, telehealth is encouraged and covered right now, and we're going to continue to see what we can do to expand it as we move forward. We've also been placing a high focus on health equity and high-risk populations, and the conversation already was held here about our populations here in the DD system. Our individuals who use these services are high risk, and we place them of high importance for us. Now, I did want to mention, we did talk about related to the COVID, and it was mentioned during our conversations here. Unfortunately, we were, during the regular session before COVID struck, we were going to see those rates increase for skilled nursing. And also with the refresh, we are very hopeful that as the budget changes, if we do see improvement on that we see those increases come back in at some time. But I do want to mention on the skilled nursing component that we're not only looking at rate increases, but looking at creative ways for how skilled nursing can be delivered in a different way. And there's a work group underway. It's been meeting for 2 months to see if we can find a different way to render nursing so people who get authorized for those hours do actually able to get those full hours covered. So it's something that is not lost on us, and we absolutely want to make sure that you have. Also, I did see on the text There was a concern about needing increases for personal care. Wanted to mention to you that that was protected, and in July 1, there was a 5% increase for personal care rate increases. Did want to mention that to our audience. Also, we talked about provider retainer payments and rate increases to help providers during this period of time when things were closed and people weren't operating. And we talked about day services. We also did support on the other side adult day health centers, and that was through June 30th. And we're also looking at other avenues for support this way as well. And mentioning the staffing flexibilities down below. Some other areas which were particularly hard hit were beneficiaries and nursing facilities. And so we had to provide additional support for them in that area. And also for individuals living in the community, relaxing certain staffing capacity requirements to allow them more flexibility to be trained, hiring people, providing oversight and other requirements, particularly like with face-to-face requirements with care managers, I think have been particularly noted and helpful for people. Also, we know this has been of big importance to people to allow spouses and parents of minor children and legal guardians to provide and receive reimbursement for personal care. We're also I'm seeing a lot of that, a lot of chat, and also people asking us to continue to look at that as a long-term solution. And you have our firm assurances that we will explore that and continue to look at that for you as an avenue that we will likely need to go through and work with our legislative members to make happen. Some of the other pieces, you may hear this from time to time. What is the authority that we use to do that? Or you may already be aware of it. It's called an Appendix K. Our federal partners have been very gracious in helping and working with us on this particular piece. And we have authorities to make these changes all the way through March of next year to sustain those necessary flexibilities that help only you and your family and also our providers during this really critical time. Of particular need that they asked us to talk about as well are the high need supports benefits. So we did recently want to announce that we did receive federal approval to offer housing and employment supports for Medicaid members who are age 18 and older who have significant behavioral and physical health needs. I do want to mention that individuals who are on the DD waiver for this service, would not be available for them, but if you're on the wait list, they may be eligible. While we have received federal approval for this, we have, due to COVID, this has been on hold for now, and we would need to wait until our economy is in a situation where we can receive sufficient authority and funding through the administration, through the Governor Northam, and also our General Assembly to offer the service. We would anticipate, if in ideal situations, to be able to offer the benefit in July of 2022. But as I've said, we also need to take a strong look at our economy and where it's going. And there were several other key components regarding the waiver refresh, skilled nursing, and even the rebates I've heard discussed that are going to be high priorities of not only of our administration, but of the legislature. And so this is a really important key benefit that we want to offer at some point in the future. But I do want to mention that there will be other priorities as well. But if it does, when we do have an opportunity to offer it, the new service is going to offer key interventions, as you can see right here on the slide, that help keep people to transition into the community and obtain assistance to do those, to get jobs, and to actually help coach people to obtain and maintain jobs, and also to help them obtain and maintain housing, which is really, really important. Another particular piece I want to talk about that was mentioned earlier is for using CARES Act funding. We're covering personal protective equipment for individuals who receive consumer-directed personal care, consumer-directed services. And so the first batch of masks went out to all members. And we are also setting up an avenue to make sure that if individuals request, starting this month, and we'll let you know more as we have it set up and available, though you'll be able to request and receive additional, not only masks, but gloves as well as hand sanitizer. So we're very excited about being able to set that up for you. We know that there's so much going on. We do understand the tremendous risk and the care and commitment that goes in with attendants coming in to support you and your loved ones. And we want to make sure that we have these tools available to support you all as soon as possible. Also of particular importance for us, we recently established a member advisory committee that consists of individuals who receive services and their loved ones, and they meet with us quarterly and provide us with very critical feedback on how we're doing as a program, what we do need to do to change, and key issues that are happening on, they advise us on in terms of access to care, members receiving services as an examples, and like appeals and those types of examples. If you're interested in participating, we would love to have you on with us. It says here on the slide, please reach out to your health plan, but you could also, if you'd let the ARC of Virginia know, if you're interested, we'd be happy to talk with you and work with you if you'd like to be a member of our advisory committee. And we can meet, well, we did meet in person, but we're meeting virtually now, so we'd love to have you on board with us. Please, please give that some consideration. Also asked, just as a reminder to folks who are on the CCC Plus program, there are benefits available to you, and even if you may just be receiving acute and primary care, or if you have the full array of services, there are some additional benefits that the health plans are offering. Please make sure that you take advantage of them. That includes dental exams, cleanings and x-rays, as you can see on this list, hearing exams, eye exams, and also, especially during this critical time, smartphones. And we've been working with them during the public health emergencies to make sure that there's an increased allowance in the gigabyte usage, so people can do the video one-on-one chat, and also for the minutes to make sure that people have what they need to be able to meet with and talk to people that they need to best support them in their care. Did do a couple of just member stories here just to show you that we know we have a lot of work to do ahead of us that we've been hearing about and talking about here, but we also, just a couple of examples to show you how the program does work and can support you, and use of the care management system, care managers through the health plans. We had an individual using private duty, and I know I've heard about those particular issues, and we had somebody who was, their services were interrupted due to an insect infestation. And the care coordinator worked to help address that pest control problem, and also help to make sure that that individual got access to their doctor, to make sure that that necessary medical equipment, which was a stroller chair, was available to them. So please make sure you utilize that care management opportunity, a care coordination, and if you have any issues or components with it that you need support with, please talk to the health plan or also contact us here at the Medicaid agency. We're happy to help you. Also, we also want to make sure we show that this program is here to support our caregivers. And an example of how a care coordinator also helped a caregiver who is supporting a loved one at home to make sure that that individual received the services they needed by connecting to their local CSB to request DD services. And so this program, and that's why just mentioning these pieces here just briefly for you to let you know that we really do care. We are here for you. We want to make sure that this program works for you. We hear all the issues and things that you're talking about right now, and we've been taking lots of notes on that, and especially about the assistive technology. I just want to mention that. And I know that the teams were working on that already, but we'll heighten that a little bit and see what we can do to advance that a little bit, especially with COVID experience happening right now. So I want to pause right here and then give some time to allow Commissioner Land to speak, and we will.
It's not presented correctly.
It's
so
not.
No.
Okay, so I
I'm
wasn't sure I wasn't doing that correctly. All right, I'm sorry. I have some help here. Okay, come on over in.
Hey, Tanya, I understand that it is not presenting exactly correctly.
It is doing the right. You were
Yep.
doing side by, yeah.
So I am going to try to open Commissioner Lands. Okay, scan sharing is stopped. Okay, that's fine.
You are working on that.
Let's get the share screen.
See why we all need help with technology? All of us do. We're all learning every day on this. Okay, you're sharing. You're doing good. Oops, and I accidentally muted you. So when I click ask, you can unmute. There you go. Thank you.
Okay, help me remember, Tanya, how to do the presenter.
Present is in your, let's see, from beginning on the, where under slides now, you go all the way to the left. Yep, present. And even if it's not the full screen, I think you're in a presenter mode. I still think that our audience can
Right.
see.
I'm just trying. You're seeing like the main slide and the next slide, correct?
That's correct.
In the notes. So that's what I'm trying to
Get rid of.
get rid of.
Sometimes I will tell
Mine doesn't have
if you
mine
if-
doesn't have any notes, so as long as they can handle the next slide, that should be okay.
I just
That
wanted
is
to
just
make
fine.
sure.
Thank you. And for the audience, if you're having trouble seeing and you need it to be bigger, if you put your cursor in the middle by your window, you can drag that to make it bigger, and the speakers will disappear, but it'll make it how you need to view it. Go ahead, Commissioner Land. Thank you so much for your patience.
Oh, I'm so glad to be here. Can you hear me? Am I clear?
You are good. Yes, ma'am.
Okay. Thanks for having us come, and what we were asked to share is a update on the COVID-19 impact at DBHDS and in our community services boards and our licensed providers, as well as an update on our progress and status on the DOJ settlement agreement activities. And so for the next slide, starting with the COVID-19 impact, like all of you, DBHDS has been tremendously impacted by COVID-19, and I'll just say that I continue to be amazed by the efforts of everyone at DBHDS, our facilities, the CSBs, and our community partners, who in this most difficult time have rallied to make sure that the services Virginians count on remain available to them as much as is safely possible. And so wanted to start out talking a little bit about what our CSBs have experienced, and they've had a massive effect. Their leadership and staff have worked very hard to make sure they're still providing all of their code mandated services, and they're prioritizing essential services, including things like pre-screening, pre-discharge planning, and diversion from inpatient hospitalization. They've also quickly transitioned, as we've talked about, as most providers have, to substantial use of telehealth and other alternative arrangements instead of doing face-to-face visits. Anytime that that's clinically appropriate, just to ensure everyone's health and safety, there are services that they are continuing and are required to be done face-to-face, and they're, of course, making sure that they do that safely and following all of the recommendations out of CDC and VDH. The state and federal regulation changes were wonderful to allow them to dramatically increase the use of the telehealth, but they've also experienced additional expenses like the PPE cost and actually lots of reduced visit revenue, which has in turn caused them to reduce their capacity. About 50% have undertaken some level of staff furlough between April and July. Some of those furloughs are starting to lift now as things reopen and more services can go back to safely to face-to-face. And about 25% of the CSBs did engage in some level of staff layoffs. Yet we know that these CSB services will be required even more going forward. And in the pandemic, we're seeing an increasing risk of depression, anxiety, and substance misuse. And also new research shows that the economic impact of the pandemic, as has been mentioned, could result in additional deaths of despair. So we are very, very thankful for the efforts that they're making, but it has had a tremendous impact. So next slide, Karen. When we look at what we were able to do and what's the licensed providers that are licensed through DBHDS, we actually started out and did a emergency operations center that was for benefit not only of DBHDS and its facilities, but our partners in the community and all of the licensed providers that we license. And so we have a tracking system of COVID-19 cases, and it's on our website. And you can access that and go and see how things are going within our providers at any time. And that's weekly, it's updated. They are derived from cases reported by providers in our CRIS system, which is our reporting system for incidents. They are not, reflective of the official Virginia Department of Health data, But we also are providing updates 3 times a week on positive staff and patient cases at the DBHDS facilities. And then this page also has links to guidance and resources for individuals, providers, and healthcare workers. So it's a good site to go to and look and see kind of what's happening in all things that are related to the DD system, the behavioral health system, and within our facilities at DBHDS. And next slide, Karen, thank you. We also are tracking cases in our 12 facilities, as I said, and then our agency licenses approximately 1,100 community providers of mental health, substance use disorder, and developmental disability services across the state. And so this is a chart that shows where we were at on July 23rd. And so, and there were 629 positive cases in all of our providers and facilities, 55 residential outbreaks reported, and a total of 33 COVID-19 related deaths. And this is out of tens of thousands of individuals that we serve, to give you some perspective on the case count. Next slide. We also are tracking the impact of COVID on the delivery system and looking at it by the type of impact as well as the types of providers. So tracking where the services are being delivered, like via telehealth, for example, or where operations are temporarily suspended. We're tracking changes to capacity, including staffing, changes to admission and admission policies, location changes. Services are being tracked among CSBs and private DBHDS licensed providers. And that includes case management, children's residential programs, correctional facilities, day support, inpatient, intensive in-home, all the different types of services we're continuing to track and make sure that we're understanding what's happening with the services that need to be delivered. And we're seeing that the most widespread disruptions are appearing among the day support and residential services. And you can see the type of adjustments and the changes to staffing, both from CSB and then the licensed providers on the table there. So you can see that's data as of July 4th. Next slide. So we have getting lots of information so that we can keep track of what's going on and what supports and flexibilities and guidance that we can give. We've also seen an impact as it relates to our ability to meet the compliance for the settlement agreement. DBHDS is currently dealing, as all the state is, with a hiring freeze and the budget implications that have been shared already on the call from COVID-19. And we're hopeful that after the special session later this month that we may know more about the budget. We were able to have many things approved in the last session that would facilitate the settlement agreement compliance. And this is a partial list of impacted services that will impact our ability to meet our compliance metrics. So currently, many of the case managers are not able to complete face-to-face visits. All are allowed to be completed via telehealth. So that is that silver lining again of the telehealth. We are being able to require the compliance indicators and discussing those. The majority of the integrated day and employment providers have stopped delivering services. Nursing service utilization, in-home and personal care utilization has been impacted negatively. The REACH staff are not able to respond face-to-face to all crisis calls. We are seeing that the quality services reviews will be beginning again in 2 weeks. We have a new vendor, so that will be important. And then the on-site licensing and human rights visits, which have been restricted to only those incidents that involve imminent danger to go and do a survey visit on site. Despite the pandemic, the judge has not adjusted the timeline and requirements that were set just this past January. that said that we must, those things that we must address to come into compliance. And we understand how challenging this is to many of you, given the uphill battles you're currently facing. There are many factors that we cannot control in this situation, but we can control the identification of areas where we still can make progress and do our due diligence. So we're still in line with the consent decree, excuse me. All the steps that we've taken since 2012 have been like building blocks, is the way I like to think of it, each lifting us a little higher so we can reach that next step. It took over 8 long years of intensive work with many partners like you to get where we are now, and we need to build more height to reach that next and final step. And we hope that showing forward progress will cast our efforts in a positive and favorable light with the DOJ and with the judge. And we stand ready to provide the technical assistance needed to take the steps forward to improve the lives of those we serve despite these challenging times. Wanted to, we're of course in our 9th year of its 10-year implementation process for the settlement agreement. We've seen substantial improvement over those 9 years. We now have a more comprehensive home and community-based services that promote community integration and quality improvement. And as we move into this next portion of the presentation, please recall that in January of this year, 2020, Virginia, the DOJ, and the judge finalized the actual compliance measures of what would show compliance and be the evidence of compliance. And there were 328 compliance indicators that were set. And so that's a very large number. And we're currently looking at what it'll take to implement the measures, particularly the data requirements. And so the next slide. And I may run out of time because we're coming up right on the end of the time. I wanted to be able to share that we have made, so I'm going to move fast just for a second. We were able to spend much of this time over the last 4 months really working on what we called a build phase, so building out all of those provisions. If there was a report or a form or a process, whatever it took to get it, the trainings around it, all of that, and we're able to get everything built. So now we've moved into what we call the run phase. So I'm just going to make this a little bit quicker. Let's move forward a slide. So we were actually have reached 62 compliance. The 38% will be what we have to show over the next 12 months in compliance. And so how we did that, the next slide, was we really put a project management approach in place where we could have these work streams that you see in this big picture view, the case management, crisis management, integrated setting, provider partnerships. We put together work streams and had people just focusing within a specific work stream. We really got it all the way to the finish line for those 328 indicators, building what was necessary to make them able to be achieved. And what we're trying to achieve are across the top in the pink, so that we're hitting on all the goals of the DOJ program, because just like Karen said, you know, we're not in this to just get over a finish line. We're in it because we care and we want to make sure that all of those high level, big picture goals of what we're trying to achieve really do come true for all the individuals that we need to serve and support. And so we're looking forward to being able, we do not know that we will be able to exit on time, but we have set ourselves up for success to be able to, once we're able to get the providers and the access and the capacity back online, to really do this right. And so that's hopeful of where we're going to go. And I'm going to stop there. I know I still had more slides. I'm sorry.
You did incredible, Allison. I'm so sorry that it was tight timing there. I will tell you that we're grateful for the work that your team has been doing on this, and there is a session on Thursday with someone from your team to go over that compliance library and go a little deeper on the issues you mentioned of DOJ compliance and going through the evidence and where that can be found by the public. And that's at noon on Thursday. So thank you so much for that. Kim?
And we are out of time, and we value your time, every one of you, and we appreciate those that have been able to stay on. I just want to ask, if you're able, could you give us like maybe 5 to 10 minutes just for a couple of questions that Lucy has for people that sent in questions? Is that okay with everybody? 10 minutes? Thank you so much. Thank you. All right, Lucy.
Hello, there have been thousands of comments in case anybody's wondering about lots of topics, and we have to narrow this down. I want to bring this question forward from a parent in Northern Virginia. Her son was discharged from his group home in February. Then he was placed in a mental health hospital, and this is a young man with a developmental disability. And they were told that the Reach Crisis Home in their region could not serve him because the Reach home had someone that they didn't think he would be compatible with. So this young man has no anticipated discharge date. So he's been in an institution, in a mental health institution since February, and he could be served at a much lower cost if Reach or our community-based crisis service for people with developmental disabilities was able to serve him. He's just representative of one person, but what is Virginia doing to address the needs of people with DD who have very complex medical conditions and emotional regulation conditions?
So, hey, it's Allison Land. What I would do is ask that individuals or the parent to get in touch with Heather Norton, and I can give you her phone number right now, 804-239-5155. Call first thing in the morning and she will take care of you and get started on that situation.
Okay, thank you for that answer, Allison Land. I want to bring up one other person, another parent. Her adult son has autism, and he has other very serious medical conditions that at times require treatment in the hospital for life-threatening conditions. Last month, he needed hospitalization because a drug was erroneously prescribed, and thank goodness another physician figured out what was happening, because he had become totally physically out of control, injuring himself numerous times, and it was dangerous for others in his presence. He was taken to the hospital, a major hospital in Virginia, and he was there for hours, and there was no place for him at the hospital. They wanted to send him to Central State. That was totally not going to work. Fortunately, this individual and his family, they have provided a room in a house that is totally padded, and this young man who was physically out of control because of this erroneous medication error, he was physically out of control for 3 days, night and day. What can we do, Virginia?
So was that go ahead, Karen, I'm sorry.
Well, no, Commissioner, if you want, so one thing, it would be helpful for us to know who this individual is. If you'd like to reach out I know you could talk with Heather, but you can also reach out to Ann Bevan, I think, who had done a presentation earlier with you guys earlier today, but since it's tied to Medicaid and the acute and primary care needs, we can find out what's going on and definitely help on the physician side and the medications and see what we can do with it, because I'm sure that individual has a health plan care manager, so we can at least work on that, and then I'll turn it over to Allison for the other components. But we are more than happy to help you and your loved one with that situation. I'm so sorry that has happened, but we will do what we can to help you for sure.
Yeah, I was gonna ask, was that, you said there was a room in a house, or was that at the ED? Because definitely should reach out to the care coordinator, I would imagine, in any of those situations to get the support.
They at their own expense have provided a safe room, but had they not been able to do that, he would have been sent to the States. So the family, for 3 days were managing this.
And I think what this shows us, if I can interject, is one, the care and concern that immediately comes to mind from everyone here is the desire to jump in. Allison, when you were saying call Heather, Heather had already typed that in the chat box, and Karen's jumping in. I think with specific situations, it is good to know that we can reach out. The broader question would be that we can't do in these few minutes because we have 5 minutes, left. But I think the broader question for us all to think about is what Virginia will do. And I think this goes to you as the state leaders, to our senators and delegates, to think about that as a broader issue that we do hear very regularly, that people with complex medical needs that have issues and difficulties with regulating their emotions and actions really are left when they're in crisis with nothing. So I think it's something that we come back to, and I think it's great that both of you are trying to jump in to solve the problems. And I think it's something that we should all just keep talking about. That would be my impression if that. Okay. Well, thank you for that, Lucy. Is there one last?
And this is for this is for the senator and delegates, whoever we have left. This is from a person who's a self-advocate. For far too long, the person with a developmental disability voice has not been listened to in Virginia. What are you doing to ensure that people with developmental disabilities have a seat at the discussion table around decisions that affect people with developmental disabilities now and in the future?
Sorry, sir. Senator, there you go.
All right, I'm unmuted now, so
Yes,
I will be happy to respond. I have met many times with groups of people who have disabilities so that they can firsthand make sure that I understand the challenges and the successes that they've had, and what works and what hasn't worked for them. And also met with many families and met with various art groups locally here in Northern Virginia, in addition to dealing with things through the Arc of Virginia. And I was at that thing that Evan Hanger was talking about. I think it was 2 years ago down in Norfolk. So he and I were both down there. But it's important for us to be able to hear directly from the individuals and from their families of what the situations are. And actually, the Arc of Northern Virginia last year did have a little forum where they brought in, but not only the delegates and senators who were up for re-election, but their opponents. And so we had some discussions to get everybody a little better educated on things. And all these things do make a big difference, because it's important for us to have a very strong perception and an understanding of what's going on.
I think, and I think Karen mentioned an opportunity earlier with the group that you mentioned. So there's some real opportunity for people to get involved. So we'll make sure that folks have that information to reach out. And we know that Senator Barker, Senator Hanger, Delegate Sickles, really all of our champions have a very open door. And we are very happy to walk through that door on a regular basis. And that includes people with disabilities. You asked, or Delegate Sickles asked, about specific ideas. And so you can rest assured the Arc of Virginia and the people with disabilities from the Alliance will be back in touch as you go into session to share any ideas that we have taken from the chat box. There are so many comments being put in there, and I'm happy to share that with anyone, and we will definitely follow back up. Kim?
I just want to thank everybody for coming tonight and taking your valuable time. I know you're all tired, you've worked all day, and we appreciate every minute that you give us. even with the hard stuff, we know that we're not always, we have a lot of hard questions, but we appreciate your honesty, and we also appreciate you fighting for us. So thank you for extending us the time. We apologize for going over, and we hope you all stay safe from COVID, and we'll see you again. So thank you very much.
Everyone.
Good night.
Thank you.
Yeah.
Thanks, everyone.
Good night. Thank you so much.
Good night.
Night.